Hello, how are you doing today?
Good, how are you?
Good. My name's Erin Fleming. I'll be your student nurse. We just do some hand hygiene and provide privacy. I'm here to fulfill the doctor's orders. It looks like we need to do a head to toe assessment on you. Is that okay?
Yes, ma'am.
All right. So we'll just start with a couple of questions. Do you know what month it is right now?
September.
Okay. And do you know where you're at?
Home.
Okay. And do you know what brought you to the doctor's office?
An assessment.
Okay. All right, so patient is alert and oriented ×4, and he is aware of person, place, and time. All right, so overall inspection, patient is clean, has good hygiene, clothes are intact, they're not torn or anything, no obvious signs of abuse or distress. All right, let's see, so I guess if it's okay with you, I'm just going to feel your head, look for any bumps or bruises or lumps or anything like that. Alright, so there's no obvious bumps on the head or anything, no patches of hair missing or anything like that. Let's see, so now we will check your eyes. Alright, so I'm just going to put this here. And then if you would look over my shoulder, and then look back at my finger. Okay. So pupils are equal, round, and reactive to light, and their size is about 3 millimeters bilaterally. So inspecting the face, there is no scarring, no lesions, bumps, bruises, any discolored skin or anything. So now we'll check your ears out. Alright. Ears are symmetrical, bilaterally. There's no obvious injury to them, no swelling, and no drainage noted. How's your hearing? You hear okay? You don't? Have you seen the doctor about that before?
No.
Okay. Does it affect your daily life at all?
Very little.
Okay. Alright. And your vision, how's your vision?
It's good.
It's good. Okay. Have you ever had any eye surgery or wear contacts or glasses?
Surgery.
You had the LASIK surgery?
Yes.
Okay, everything's been fine ever since?
Yes.
Okay. So now I'm gonna look in your nose, make sure your nostrils are good. Alright. So there is no drainage, and the mucosa looks healthy. If you could just do a patency test for me, so just put one finger on one nostril. Can you do that? And then breathe in. Okay, and then do it to the other side. Alright, and both nostrils are patent. So now look in your mouth and your throat. Stick your tongue out and say ah. Alright, oral mucosa is pink and moist. You can put your tongue out in your mouth now. And if I could just look at your teeth. Alright, teeth are clean and white and moist and smooth. Let's see, do you ever have any trouble tasting anything or swallowing? Okay. Any tooth pain or anything like that? Alright. So now I'm going to check out your neck. If you could just lean back for me a little bit and then turn your head to one side. Okay, now the other side. Alright, there's no jugular vein distension and the trachea is midline. And if it's okay with you, I'm just going to palpate your neck here and see if you have any swollen glands or anything. Does any of that hurt? If you could swallow for me. Any trouble with that? Alright, no trouble with swallowing, no pain. Patient appears to have full range of motion when he turns his head from side to side. Alright, so now I'm going to listen to your respirations.
Okay.
Alright, so every time my stethoscope touches your skin, if you just take a deep breath in for me. Normally, I would have the patient remove their gown so that I can have the stethoscope on skin to skin contact. Okay. What? Breathe in. Upper right lobe is clear. Upper left lobe is clear. Lower left lobe is clear. Lower right lobe is clear. And if you could just put this arm up on your shoulder so I can listen laterally. And now let's do the other arm. Alright. I'm just going to come behind you here so I can listen to your lung sounds in the back. Alright, so upper right lobe. Upper left lobe. Lower left lobe. And lower right lobe. Okay, lung sounds are clear. There's no adventitious sounds when the patient's breathing. So now I'm just going to listen to your heart sounds. Aortic valve. Pulmonic valve. Herb's point. Tricuspid valve. And the mitral valve. Alright, S1 and S2 sounds were heard, and there weren't any adventitious heart sounds. Okay, let's see, do you normally have good blood pressure? Is it normally high or low?
Normally a little high.
A little high, okay. Do you take anything for that?
No.
No? Okay. Does it ever make you feel anxious or out of breath? Okay, no shortness of breath ever?
No.
Alright. Well, speaking of breathing, since we are coming up on flu season, you could get sick or your lungs kind of fill up with mucus at times. Have you had any of that lately?
No.
No? You don't ever cough anything up in the mornings?
No.
Okay. Well, just in case you do feel congested, there's a couple of things you can do. You can do the turn, cough, and deep breathe. So it's like if you're laying down for a while, you can do this about once every 2 hours. So if you're laying on one side, you can turn to the other side, take a deep breath, and then cough, and that helps expectorate some of that mucus. And then you can turn and do the other side.
Okay.
And then the other thing is the incentive spirometer, and it looks like something like this. And so here we'll have a little goal we can set for you, and you put your mouth to the mouthpiece, and you hold it there as you inhale, and that'll make that little ball go up to your goal, and that helps you expand your lungs, which will help your lungs function a little better and get some of that gunk out.
Okay.
And so that you would want to do about 10 times every hour, but not all at once, because you could start feeling dizzy or something, so you could do it like every commercial break. Okay. All right, let's see. So, let's see. If you could actually lay down for me, and then I can listen to your vowel sounds. All right. Alright, so for the purposes of the video, I'm gonna start in the lower right quadrant. And if I hear bowel sounds in the first 15 seconds, I will not do the whole minute in all 4 quadrants, but normally I would do a whole minute in all 4 quadrants. Alright, so I heard bowel sounds in all 4 quadrants. I can just inspect the skin here. Okay. And I'm just gonna palpate lightly. Is there any pain?
No, ma'am.
Do you have normal bowel movements?
Yes, ma'am.
Alright. Passing gas normally? Okay. Alright. So all bowel sounds were heard in all 4 quadrants. I did not feel any masses or lumps upon palpating, and the skin is intact. Skin tone is appropriate for the patient's ethnicity. No scarring, or anything like that. Alright, so now I'm just going to feel your upper and lower extremities for any swelling. Alright, and I'm just gonna check your capillary refill. Capillary refill is 1 second. And I'm gonna check your skin turgor, which checks your hydration level. Alright, and then now I will check your radial pulses bilaterally. Radial pulses are both at a +3, with equal rhythm. So now I'm going to check the lower extremities. Alright, now edema in the lower extremities. Now I'm going to check your pedal pulses. So we'll do the dorsus pedalis bilaterally. Those would be a +2. And the posterior tibial. Also a +2. Alright. Let's see, I'm also going to check your carotid pulses. Alright. Here's your brachial pulse. Carotid pulses were equal bilaterally and a +3, and brachial pulses were also a +3, equal bilaterally. Okay, so now if I can have you sit up, we're going to do a little range of motion and strength testing on some of your extremities. Alright, let's see. We're gonna do, so we'll start with your hands, or well, your fingers. So if you would put your fingers together like this, that's called adduction, and then spread them apart, it's abduction. Abduction. And then if you bend them down, that's flexion, and straight out is extension. And can you bend them back anymore? That's hyperextension. Okay? So now if you would just squeeze my hand, okay? Alright. And then just using your fingers, not your arms, try to push my hands down. Okay. And then let it go up a little. Okay? Alright. Let's see. So now we could do your shoulders. So I'm going to put my hand on your shoulder to feel if there's any popping or crepitus in it. So if you would just put your shoulder straight out to the side of you. Okay. And then put it back down, and that's adduction. And then can you put it back at all? Okay. And then back to the middle. And then can you raise it, your arms straight up? Alright, that was extension. Okay, so I didn't feel any popping, so now let's do the same thing with this one. So if you can put it out to the side. Okay, and back down. Okay, and then straight out in front of you. Okay, and then, oh, there's a pop. And then back a little bit, if you can. Any of that hurt? Okay. So now, just hold your arms straight out in front of you, and now I do want you to keep your arms straight. Use your whole arm. You can turn your hands up if that's easier. And then try to push my hands up. Okay. Now try to push my hands down. Alright. Okay. So now we can do some for your feet. Alright. So just sitting there, if you can flex your feet up like this, okay, and then point them down. That's extension, okay. And can you do them in a circle, circumduction? Okay. I just heard your ankles popping. Do you ever have pain in your ankles? No. No? Okay. All right. So now we're going to test your strength. So bending at the ankle, try to push my hands up. Okay. And, push my hands down. Okay. And now we can do, can you see how your knees are? So if you would extend your knee. Okay, straight up, and then back down. Okay. Alright, I don't feel any popping there. Do the other one, and extend straight out. And flexion. Alright, so there's some popping there. Ever have any pain in your knees? Yeah, you do? How often does that happen?
Every day.
Every day? What level of pain would you say that was?
A 3.
A 3? Okay. Is it like a throbbing pain or like a sharp stabbing? A throbbing pain? Okay. I didn't notice any swelling with your knee. How long has that been going on for?
A few years.
A few years. Did anything happen in particular to start it?
No.
Okay. Does anything make it feel better?
Ibuprofen.
Ibuprofen helps. Okay. All right. Does it affect your daily life at all?
No.
All right. Okay. Well, I think we covered everything. Let me just check and see here. All right, so it looks like we got everything. The only thing I didn't mention was the Glasgow Coma Scale. And so that is a scale that we use to assess any potential for head trauma. So if you are if you score between a 13 and a 15, there's little to no risk of any head trauma. Less 8 or less, there is mild risk, and if it's really down to like a 2 or 1 or a 0, it would be unconscious or severe head trauma. And because you are alert and oriented and everything and obey commands, I would say you're at a 15, so we don't have to worry about that for you. All right, do you have any questions?
No, ma'am.
All right, well, thank you so much. The doctor will be in soon.
All right, thanks.
All right, you're welcome.